Good morning, Tony. Thank you so much for joining me for a Corona conversation. If you could just introduce yourself, tell people what you do for a job and where you are now.
Okay, good morning. My name is Antoni Gual. I'm a psychiatrist based in Barcelona city, actually leading the addictions unit in the university hospital, what's called the clinic hospital. And we're running a clinic which has inpatient and outpatient facilities, and also that is deeply involved in the teaching of students through the University of Barcelona.
Thank you. So it's now April the 3rd, 2020. Spain has been in lockdown coming up for 4 weeks. And as we know, Spain has been one of the epicenters for COVID-19. Could you start us off by telling us a little bit about what the impact has been so far on people who've got drug and alcohol problems in Spain?
It's difficult to say at this moment because we don't have that much information. I assume, taking into account what the literature says, that for lots of people, the confinement means less use of drugs, less use of alcohol. And concerning the treatment facilities, at least in our situation, it's meant that the treatment facilities have been reduced to a minimum, and that anything that is not really urgent is not done. Our whole hospital now is a COVID hospital, so 100% of the beds in the hospital are devoted to the treatment of the epidemic, which means that no other pathologies, including our patients, are admitted at the hospital, which will mean waiting lists, which will mean that we will need to find imaginative ways to deal with the things that will be piling up and that we really don't know its dimension now. I mean, that's going to be evident in a few weeks. It also means that we're doing a lot of teleworking. So we've been lucky that our hospital has the ability to provide us with remote access to the medical records of our patients. And we've been doing as many visits as possible from home. It also means that some of our colleagues are also impacted by the coronavirus. I think that we have around 16% of the patients with coronavirus are from the health system. And I can say that in our team, I think our team is 28 people, and we have 3 people today which are fortunately recovering well from coronavirus, which is 3 out of 28. That's a lot, in fact. Plus 4 other people who have been impacted also by the crisis and are not ready to work. So it's 7 out of 28 which cannot work. But it also means that we all are trying to work from home. We've reduced to a very minimum our presence in the hospital because we are not needed there, in fact. And we are devoting part of our time to provide psychological support to the professionals in the hospital.
Okay.
And in the end, this means that we are still providing, for example, basic treatment like urgent detoxifications, methadone maintenance, Suboxone inductions, but this is to very few patients. That's what's happening.
For the people who were already on methadone and buprenorphine, have the rules relaxed to allow people to have more unsupervised doses now, so they don't have to come to the clinic or to the pharmacy as often?
Yes, we have received. We were already doing it, but we have received directions from the Directorate of Addictions in order that all the centers try to provide as much as possible larger take-home options, and in order to restrict to as much as possible the travel of people.
Okay. What about the really vulnerable, marginalized group? So homeless people who are also injecting drugs. Has there been any capacity to provide those people with a roof over their head, with basic sanitation? And has there been an additional effort to get people who were not in treatment into treatment now, as the illicit drug supply perhaps dries up? Have you been able to expand services?
We've not. There's been an expansion of services, basically to provide roof to all these people. This has come through the need to keep them controlled. So it's not been mostly health approach. It's been much more compulsory approach, so that the quarantine is respected. And this has been running now for about 1 week. And there are special areas where these people have been gathered. That was done immediately. And now we are in the position where the administration is trying to have professionals to provide help there. It's mostly done on a voluntary basis. So the next step is when those professionals are there, if they can do any additional work on the addiction aspects of this vulnerable population. And I think that that's where we are now.
Okay. One of the things you said very early on, Tony, is that you thought that people's use of drugs and alcohol may be decreasing. And you specifically said you thought people would be drinking less. Is that because drinking in Spain is such a social event that now people are confined to their home, they're not drinking more to relieve boredom? That's something we've heard from other countries.
That's one of the things. Also, when people perceive that they will be, that their money will be reduced, that they will have, I mean, there's lots of people who have lost their work, and in this situation, we saw it in the 2008 crisis. When people have less money, they drink less and they take less drugs. Even though we also know that people under stress, they will find themselves in a situation where they tend to use more. But in the end, most of the, I mean, you probably see two different pictures here. One is when you look at people who are really addicts, you may expect that in a way they will increase. But then you have lots of population who are abusing, let's say, without a real dependence, where you should expect that they would be using less.
Okay. Has there been any kind of impact on the illicit drug supply to Spain at the moment? Have you heard any stories of either cocaine purity falling or heroin drying up, patients not being able to access drugs?
No, I cannot say I have very good information at this moment, but what I've seen in the news, there was in the newspaper yesterday complaints on the neighborhood of the area which is called La Mina, which is an area where drug dealers tend to be quite well established. And some neighbors were complaining that some addicts are occupying some of the houses in this area, so that since it is difficult to move around the city now, they tend to remain there so that their access to the drug is easier. I don't know to what point this is real, or it's just something in the that very few people have done. But that's the only thing I've heard. I've not heard about changes in the purity of the drugs.
Okay. And has there been any change in the way the police are choosing to deal with people found in possession of small amounts of drugs? Are they paying less attention because they have other things to do, or are they continuing to enforce drug laws as they normally would?
I think that this hasn't changed that much. The police is making a lot of emphasis and emphasize on the confinement, and probably this is having an impact. So I remember one of my patients told me in the beginning of this week that he was feeling like taking cocaine, but going to buy it, and that this moment was more difficult than usual. So that helped him to stop and not do it. And I assume this is also happening.
When people might be more worried about going out to buy illegal drugs, is there a risk within Spain that people are going to be seeking to buy prescription medications or obtain prescription medications from their GP? So increased requests for benzodiazepines and prescription opioids?
Not at this moment, because everybody is very aware that GPs are now working very hard. They see COVID patients in their consultations. So it's quite unlikely that people will think of just going to the GP and try to discuss with him to get some benzodiazepines, have to wait in the waiting room with people who may be infected. So it's not really appealing.
It's not very attractive, absolutely. So my final question, Tony, is I want you to think a year from now, when hopefully COVID has disappeared from our lives. Do you think that COVID will lead to any long-lasting changes in the way that drug treatment is delivered in Spain and also in drug policy around legalization or criminalization?
That's, I mean, in the actual situation, what we tend to do is to react more than to plan. Mm-hmm. So to give you an example, we are organizing turns in my team to deal with the different areas we're working. And today, Friday, I'm organizing what's going to happen on Monday. And I don't do it sooner, because if I try to do it 1 week in advance, it doesn't make much sense. Maybe one of my professionals gets sick, and maybe the hospital decides that those beds are not used for one thing, but for another one. So this is a very changing scenario. And it's very, very difficult to think of what's going to be life in 1 year time, because it also depends on what happens with the coronavirus during this time, which is not clear at the moment. I can see that we will certainly, from the clinical perspective, this will make a push for telemedicine. I mean, it's very clear. We all knew that this works. Now we are obliged to use it, and people will see that it makes sense to avoid people moving around so much. So it's not just the addiction field. I think that in all areas of our life, we will tend much more to do what we are doing now, which is talking through the computer instead of taking a plane or a train or a car and meeting in person. That's to me absolutely clear. Probably this will be linked also to the use of new technologies in the treatment, which means wearables, apps in the cell phones, and that this is something that was going on and will experience a tremendous push, I would say. I can't see why we should have changes in policy. No, it's difficult for me to think of that. Just wait for a moment. Pablo, et truco en 2 minuts, que estic en una teleconferència. Et truco en 5-10 minuts. Vinga. The policy regarding legal or illegal drugs, I think it's going to remain pretty much under the same lines it's been up till now.
So for you, the biggest change is going to be not how drug treatment is delivered, but how we interact with our patients And some of our patients may prefer that. They may not want to come to the clinic every day. And as long as we provide them with access to an internet, we actually might become more efficient.
Yeah, yeah. And also, it has some advantages. So,
yeah.
Even concerning privacy, for example, I mean, a waiting room in an addiction clinic is something very stressful for quite a few patients. So if you can avoid the waiting room, this may be appealing to you.
It's a really interesting thing you just said, Tony. I hadn't considered that, of course, one of the biggest barriers to people seeking treatment from people like you and I is anonymity and confidentiality, which of course is ruined the moment you walk into a drug clinic. Being able to see a drug specialist now, anonymously, confidentially, could actually make people more willing to come forward and seek treatment. Nobody had raised that, but actually that's an incredibly important potential positive. So,
which in turn creates another problem of confidentiality, which is where are you when you're having the interview? Because I mean, you may be a privileged who has a very big house and a locked room where you can talk freely, but you may also live in a small apartment with your family, the kids, and then it's not so easy to find a place in an hour where you can speak comfortably to someone who is miles away.
I'm thinking maybe this is something, Tony, you and I might have to write something about the pros and cons in telehealth and how to protect anonymity online when talking to an addiction specialist. It's a fascinating place to end, actually, and also quite a positive place to end, because so many of the conversations are difficult and challenging, and it's only just beginning. So thank you so much for taking the time, Tony. Stay safe and healthy, and we'll probably come back and maybe follow up in a couple of months' time to see how things are progressing, and hopefully by that time, Spain will be well on its way to a full recovery.
Well, I hope so.
And so the question that you chose to ask, will it be better where we're going? And though the answer I don't know for a fact, still my heart is saying, oh yeah.
Still just taking it one day at a time. Still don't know what I'm trying to find. Really I don't mind, cause I'll be fine.